Dr. Kaumeyer has been at the center for just almost a year and a half. Year and a half now, and working with the medical team, with Dr. Ron and Dr. Henshaw. So this will be an opportunity for you to participate a bit too about presenting of these case. I don't know how many case studies we'll get to, but they'll kind of go back and forth between Dr. Kaumeyer and Dr. Wassell.
Can everyone hear me okay? Well, I want to say, wow, it's just a real big honor for me to be standing here in front of all of you guys right now. It's been an honor to be here at the Riordan Clinic for the last year and a half. It's kind of a long story how I ended up here, but my father, who I'm going to give the mic to in just a minute, is one of the reasons why I ended up here at the Riordan Clinic and how I found out of the Riordan Clinic. But I am a naturopathic doctor. I graduated from SC&M, Southwest College in Arizona, and I have been here since March of 2011. And Dr. Ron asked me today to talk about some IVC case studies. And we decided that we kind of do a father-daughter type of presentation. So I'm going to talk about one particular case study of mine in a minute. Honestly, I've seen so many amazing stories, so many amazing things happen, not only with IV vitamin C, but all the other IV nutrient therapies we do. Dr. Ron's been an amazing teacher for me. I told him right before he left today that I was writing down all his little quotes so that 30 years from now when I'm his age, I can stand up here saying I'm quoting him. So I've seen amazing things with our nutrient therapy. Like he said, you know, the most important nutrient is the one you're lowest in. And I've had some jaw-dropping things happen with patients. Sometimes I tell them, I don't know how you cured yourself, basically. It's been some amazing things just with looking at the nutrient levels and replenishing their deficiencies. But when he asked me to talk about IVC case studies in cancer, this one particular case came to mind right away. This is first of all, I'm going to give you a little synopsis about this patient's history, and then I'll talk about what we've been doing since I started seeing him a year ago. But this patient is a 62-year-old male currently. He has stage 4 colorectal cancer. He was diagnosed in 2005 at the age of 55. He had mets to his liver and lung. He was given, at the time of diagnosis, 6 months to live without therapy, and possibly maybe 3 to 5 years with therapy. And currently he's been alive now 7 years post-diagnosis, and I'm going to tell you that little story about him. But he's sought conventional medicine and has been doing it throughout the last 7 years. He's been on 5 rounds of chemotherapy since 2005. Again, I'm just doing a general synopsis right now of everything. He had a colon resection in November of 2006. A little over a foot of his colon was removed. He also, I've gone through every little, I'm hoping to do a more formal write-up eventually, but all his CT scans, he's had a CT scan basically every 2 months. They've been tracking his carcinoma embryonic antigen levels, CA levels, LDH, liver enzymes, PET scans. I've kind of gone through them all. He had a liver nodule at diagnosis, and that hasn't changed or budged at all since 2005. And then, so he started chemotherapy, and they were tracking his CEA levels. I put down there at the bottom, it was 157.7 upon diagnosis. And within a few months of chemo, that dropped down low, and it never got any higher than 1.4 until they decided in 2009, he had these 2 spots in his liver, and they decided to go in and resect those spots in his liver. And for a while, he was not on chemotherapy after the resection. And the biopsy said that there were signs of metastatic disease, but there was no active disease in the liver at the time when they did the resection. So his CEA levels got up to 7.9 after that round after the liver resection. But I started seeing him, so that's a little bit of a history before I saw him. I started seeing this patient on September 28, 2011. He was on his 5th round of chemo at the time. His CEA levels, he came because his CEA levels were gradually rising. They were around the 30s and 40s. That had been no higher than 1.4 prior. he was having horrible, horrible side effects of the radiation, which I think this is a really good case study to present after Dr. Bauerschmidt's little case. But he had severe, dreadful thinking. He says he was thinking of mortality all the time. It's all he thought about. He even said, he made a point to me that he started this thinking back in 2004, even before his diagnosis. He had really bad thoughts, and he felt hopeless, fatigue, muscle weakness, and neuropathy. And his goal for coming to the Riordan Clinic was, he put on in his paper, for increased strength and optimism. That was his main goal for seeking our care. And so that was the goal that I was hoping that we would accomplish through our therapies. But I want to make a point, too, that this patient, upon diagnosis, made extreme changes to his environment. We've talked about environment several times throughout this morning and how important environment is for helping patients with cancer. He, 3 years ago, I believe it was, I don't know if I have everything details right, but he gave up all his processed food. He was eating a standard American diet, chewing tobacco. He stopped everything, made a radical change in his life from an environment standpoint. He definitely did all his research even prior to coming to the Riordan Clinic. I was extremely impressed with the changes he made, the supplements he was taking. He had read a book, gosh, Patrick Quillen was the author of the book? Yeah. Quillen. And he was taking the Dragon Slayer supplement powder. If anyone knows about that, he came on that, and he's still taking that. Really great mix of nutrients. We went ahead and we did nutrient testing like we do here at the Riordan Clinic, again, to find his lowest nutrient values. We started to replenish those on top of what he was already taking. And we began the typical Riordan Clinic protocol that Dr. Ron and we presented earlier today, measuring the post-Cs. We began and have been doing 75-gram IVs. I think we're on 75 grams twice a week right now. We've been tracking his post-Cs twice a week since September 29th of 2011. Around December of 2011, we started alpha-lipoic acid injections post-IVC because really the only cancer that they're seeing is the spots that they're seeing on CT is in the liver. So I started Dr. Berkman's, I read about Dr. Berkman and ALA, so I started doing that just post-IVC in December. And everything else in his colon, and there's no lymph node activity, it's just these little nodules in the liver. So we began that in December 2011, and CE levels kept kind of gradually rising slowly. We were doing this, Grant, remember he's still taking chemotherapy, still in his 5th round of chemo. So on April 13th, I believe it was, of this year, his CE levels got up to 53. But I went through everything, and they're just constantly kind of just up and down like a roller coaster. So he stopped chemo on April 14th of this year due to neuropathy. He was having a lot of neuropathy pains and made the decision to stop the chemotherapy. So at that time, we wanted to do everything we can to help the liver because he had these nodules in the liver. So we began doing, I heard Dr. Berkman speak at the ONC-AMP conference in February in Arizona, and we started doing alpha-lipoic acid. We kind of worked our way up to 400 milligrams every day for 2 weeks, and we were going to do that every two to three months on top of the piggyback, ALA piggyback we were doing after the IVC. And we did it again 2 weeks in July. So we've done that. We also began the UBI therapy, the blood irradiation, once a week with 1 cc of hydrogen peroxide. So when we stopped the chemotherapy, CA levels actually dropped dramatically from 53 down to 15.8. But at that time, I decided to kind of do a little looking into it myself, so I started measuring them a little bit more often because we can do that here. And again, it's just kind of going up and down like this, his CEA level. So we're doing IVC, we're doing alpha-lipoic acid, we're doing UBI supplements, good dietary habits, good thinking. And currently, the patient has met all of his goals. He's got increased strength and optimism, hope, no more dreadful thinking, no pain, an amazing overall quality of life. I asked him yesterday how his weekend was last weekend, and he went to Colorado, and I said, well, what's going on in Colorado? And he said, oh, we just went to drive around and see the trees, and this couple has been an amazing inspiration to me, has been Dr. Ron talked about the importance of being a co-learner, and he's taught me not only intellectually put me back into reading the books and everything, but he's taught me a lot about life, and watching him and how he chooses to spend his time has been a great inspiration to me. And like he said, he wrote on his new patient intake form that the one thing that's changed since his diagnosis is his gratefulness to experience aging. And I think that's just a wonderful, something so great that come out of a cancer diagnosis. But, so right now his CEA levels continue to go up and down. It was back up to 42.6, and then it was down to 32 or 38.6, so it's constantly going up and down. So I'm questioning whether at this time CEA is really a good measure of his disease process anyway. Researching what CEA is, I learned that it's secreted only in cancer, and especially of the gastrointestinal tract, inflammatory conditions, liver regeneration, which he had a liver resection and we were working on regenerating the liver, and it's also secreted in a growing fetus, in the intestinal tract of a growing fetus, hence the name carcinoembryonic antigen. So my theory is, I don't know, we also has a little bit increased activity on a PET scan, but also regeneration of the liver will have increased activity on a PET scan as well. So it'll really be hard to tell. It's in the areas where they removed, where the activity on the PET scan is. There's no, his AST and ALT are normal, no real signs of liver damage. So I don't know if it's necessary cancer damaging the liver or just the liver trying to regenerate at this point in time. Or if he's in spontaneous remission like Dr. Ron talked about this morning. So that is my question. But the patient, every time I see him, he feels great, is doing wonderful. His wife once told me that she thinks he has more energy than she does, and he gets to travel all over. I think they went up to the Northeast a few times. And it is my honor that he chose to take my invitation and is sitting in our audience today. So thank you, Greg and Patsy, for your support. And he's back there if you want to raise your hand. This is my patient. So he is 7-year survival of stage 4 colorectal cancer. He has a great quality of life. No really active disease except for these spots in the liver, which the radiologist says increased metastatic disease, but I don't think he has the ability to say that on a radiology report. But I don't know if it's cancer or not, or if we should do a biopsy, but that's my case presentation I want to present for you today. He's been an amazing inspiration for me, and another really good example of how it is not just IVC or just this nutrient or that nutrient. It's about the holistic approach to medicine that naturopathic doctors take, that we here at the Riordan Clinic take, and I just want to make that point with this case. So without further ado, I'm going to introduce my dad, Dr. Wassell. He is I'll let him talk about himself, but he actually came here 10 years ago and did a fellowship. Well, he's going to talk to you about that. I'll let him explain. But he's one of the reasons why I chose not to go to the conventional medical field as a radiologist.
All right, well, it looks like we're here. I'm Dr. Wassell, and that was my lovely daughter, Jennifer. And you might be wondering how a diagnostic radiologist get up here behind the podium of an orthomolecular meeting, but it all started about 10 years ago. But before I get into that, I've got, let's see, if I spend maybe 15 minutes telling you interesting stories here and a few minutes telling you some of the cases that we had with vitamin C, and then some of the theory of cancer, the trophoblastic theory of cancer. I thought that was going to be sort of something new for people. I think the term trophoblast is probably something very few people in here are familiar with, or maybe a lot of people are, I don't know. But I'll go into that a little later. But first off, my experience with nutrition started out early when I was a little kid. My dad was a doctor, and he gave us vitamins, and it turned my urine yellow. And I like that, and they compared them to like fertilizer. And I had garden, and I tried different things on it. And one time I had these little plants growing. We put a little salt out of packages on our food, and I salted it. It made the food taste good, so I salted the plants. And the next day they were all wilted and dying. But I remember planting a seed a foot deep in the ground and never came up and stuff like that. But that was kind of early on. So I always was into vitamins, and then, you know, I went to medical school instead of going to graduate school in chemistry, just kind of because that's what happened. And when I had a lot of experiences going along, I'll tell you a few of them. In medical school, I remember Linus Pauling was running around in the 70s making all these claims about vitamin C, and I felt sorry for the guy because I figured maybe he was just a little touch senile or something. And I wasn't paying real particular attention to what he was saying out there, but I knew he was saying stuff, and vitamin C was kind of something that, you know, vitamins you didn't talk about much. And I had learned that, you know, vitamins weren't too in favor by the medical profession, because when I was in the VA hospital in Little Rock and put an old alcoholic guy on some vitamins, you know, they were kind of jibing me about it, because he gets all the vitamins. They all said, you know, you get all the vitamins and minerals you need in the food you eat. That's what my dad said too. And, you know, that was the general feeling, and it was looked down upon. So when I was in residency in diagnostic radiology, and the physicist was there telling us about the biological effects of radiation on tissue, this was at the time vitamin C was, you know, a nasty word. And, you know, you mentioned that word, you were kind of a quack. Well, he drew a Bohr model of the atom on the board there with the nucleus and electrons whizzing around it, and said, here comes a photon, you know, and it knocks an electron out. He said that makes a free radical because electrons are negative, the nucleus is positive, so it makes a free radical. And he smiled at us, and then he said, he wrote on the board, antioxidant. He said, antioxidants neutralize free radicals. And nobody said anything, and then he wrote on the board, turned around and wrote on vitamin C, and looked at us and smiled. And the first question somebody asked, well, how much vitamin C do you take? And he just continued to smile at us, you know, and he went on with the lecture. He wasn't going to get into that controversy, but at that time, you know, the vitamin C, you start promoting the benefits of a vitamin, you know, you just would be shut out. People would quit listening to you. So he wanted us, that made an impression on me when he said that. There's a lot of things that made impressions on me. And when I was in medical school, there was another thing that I remembered. I don't remember much from medical school, but I remember this, and I don't know why. But we were in pathology, first year medical school. We were in the lab. We were in a lab section, and we were talking about liver cancers, and it was boring and all this kind of stuff. And I remember them talking about it, and they said that the trophoblast theory of cancer was the only one that had any scientific weight behind it. And this is what all of the speakers up here have been talking about previously. They hadn't said the cancer cell is a trophoblast, but you'll find out that I think it probably is, and so do a lot of other people. But some other things that happened along the way was, well, I had a swimming pool that had a lot of, it had this brown stain on it that you couldn't get off with a Brillo pad. And the pool guy said, throw some vitamin C pills in there. And if it clears up around them, then you know it's metallic stain, and you can, and at the time they sold vitamin C in 25, it was 2-pound bags for $25. You throw it in your pool. It's gone up in price now, and now they use sodium erythorbate, which is the vitamin C is a left-handed form of ascorbic acid. Sodium erythorbate, or whatever they call it, erythrobic acid, is the right-handed form. So this is important too, later on you'll see. But it cleared up, and I couldn't think, man, you know, what does that do in your body? I mean, it just gave me when I got out of medical school, if you asked me what was the most important vitamin, I'd have told you, thought for me, I'd probably said vitamin C, because of the fact that it was so important in our collagen formation. And then I learned later on, after coming up here, that it was a lot more important than just in collagen. I mean, there's over 10,000 biochemical reactions in the body that can't go forward without vitamin C. All of our collagen fibers have to be cross-linked. The prolyl and lysyl groups are cross-linked by one molecule of vitamin C. And if you imagine concrete with rebar in it, and when the rebar crosses, you'll see they tie it together. Well, vitamin C is them little ties. It ties the fibers together. It links the spiral fibers of collagen, makes them strong. That's why animals in nature, because they make so much vitamin C, They don't herniate discs. They don't have hernias. They heal fast. You know, you shoot a deer with an arrow, next week you go out hunting with a gun, and of course the deer gets away from you. And you kill the one with the gun you shot with the arrow a couple of weeks ago, and you know, the arrow's gone, the wound's healed up, the deer doesn't look like he ever was hurt. And then when you cut deer open, you see that they're put together so strongly. I mean, comparing that to what I saw in surgery with humans, humans aren't put together very well at all. They kind of fall apart. Not like any animal I'd ever skinned. So a lot of things happened. But then in 2002, a friend of mine came by, he had renal cell carcinoma. And he said, well, anyway, after he left, I realized renal cell was one of them. I realized that there wasn't any cure for it. Being a radiologist, I just had a patient that had developed mets in his lungs, and he didn't last very long. And I Googled renal cell carcinoma, Google search. And all of a sudden, all this stuff about bright spot came. You give me a glass of water. Bright spot came up. That's what they called the place at that time. They had pictures of metastatic tumors in the lungs going away, and their first patient happened to be a fellow with renal cell, and he did excellent. He lived 14 years or something, and he died of heart disease or something. I think it's in one of the things. They had another woman that was way out with renal cell 6 or 7 years and had some other kind of a problem, died from something else. I think it might have been an accident. But I couldn't believe that this was real, that none of this stuff was in the medical literature. I didn't believe it was real. I thought this was a bunch of quacks up here. So I signed up. I signed up to come up here because $500. I talked to Hugh, and he came up here. And, man, this place, the biochemist that had been the head at Wichita State University was in charge of the lab. They had all these little Korean PhDs running around in here doing things, fancy equipment. And I just couldn't believe it. It's kind of like, you know, if I go home and tell people this stuff, they'll think I'm a quack for sure. And if you don't have about an hour to talk to somebody and explain to them, before you get 2 or 3 words out, they just quit listening to you. So when you go to a reunion or something, they ask you what you've been doing, I'm real hesitant about getting into it because I don't want to go there. But, you know, I'm thinking back about vitamin C. I know when I threw those pills in the pool, they were 1,000 milligram pills. I know I was taking a good bit of vitamin C, but not anything what I'm taking now. Nowadays, I probably take, you know, 10 to 20 grams a day. I don't know. I don't keep track. I just pour it in my hand powder and throw it in a glass and drink it down and stuff like that. It gives you gas sometimes. But that's how you can tell if you're taking enough. Anyway, I discovered that when I came up here, I found out that animals made 50 to, oh, this blew me away. This is like a nuclear bomb went off in my head. I found out animals made 50 to 200 milligrams of per kilogram vitamin C a day. And we don't make any, 0. And they say that the recommended requirement for us is 1 milligram per kilogram per day. If you weigh 60 kilograms, that's 60 milligrams. There's no animal, the least an animal in nature makes is 50 times that. And that'd be like a dog or a cat running around the house. And I can tell you from my years being hunting and fishing and everything, I knew there was something wrong with humans. And because animals in nature are just not like us. They're not put together like us. I didn't know if we, you know, I'm beginning to think we were genetically manipulated by some alien race or something, which could be true. Anyway, nature's requirement for vitamin C is 50 to 200 milligrams per kilogram per day. And we don't get anywhere close to that. You know, and you have to take it orally. You don't absorb it all orally. So to get that amount in, you know, Linus Pauling took about 20 or so grams a day, figuring he might absorb half of it. Well, if you can get, you know, 3 grams of vitamin C in a day over a period of a day, you might absorb most of it if you take it slowly. And that's really puts you on a good, healthy plane. But one other thing I remember from medical school was that the surgeon at the VA hospital would throw residents out for smoking, and he'd catch you in a restaurant out, you know, off duty smoking. You're fired, you know. This guy was serious, and he claimed that cigarettes caused hernias. We thought this guy was crazy. He didn't know why it caused hernias, but I know why it caused hernias today, because the connective tissue in humans is just not what it's supposed to be. You know, your body has a priority system. It's not like our government. It sends the vitamin C where it's going to do the most good, get the most bang for the buck, and that's those biochemical reactions, and they're going to go forward. It's not going to put collagen fibers together and, you know, do this kind of stuff and leave other reactions, you know, uncovered. So we're working, you know, with an empty tank when it comes to vitamin C, but that really, when I found out what animals made, I couldn't believe it. And when I tell people that today and they don't just get dropping in shock, I understand that they don't know much about vitamin C, because if they did, they would be flabbergasted to find out that animals make that much. And guess what? It comes out in their urine too. And I heard something good about urine is that, you know, if you say, well, you're wasting it because it comes out in your urine, then maybe you're drinking too much water if you're making urine. Huh? You should just quit drinking water because it's coming out in your urine. You're taking too much of this stuff, you know. And to speak about expensive urine, there was in IVP conference every day at noontime at Charity Hospital, the head of urology, Dr. Schlegel, would come by, and he put every post-op bladder patient that had cancer in the bladder on, it was at least 2 grams, maybe more, of vitamin C a day to prevent recurrence. Now, that didn't mean too much to me, and I didn't know, you know, I just remember that. I don't remember there being any controversy about it, but I guess he knew that it prevented the recurrence of bladder cancer, and it certainly does, and that expensive urine you have is very good insurance that possibly, you know, if this fella, a friend of mine had expensive urine, he might not have been bothered with that kidney cancer and eventually got him, but he had a hell of a lot of stress in his life. I mean, it was more stress than you could imagine. And you know, I agree with the previous speaker on the stress issue, and also the people that have recovered from cancer, they have turned their lives around completely. You know, there was one lady, when I was sitting reading Ray's over there in New Iberia, and this doc comes down, wants to see an x-ray on this lady, said she had a big lung cancer. And I reported it as normal, so I figured I'd made a pretty bad mistake. So let's get that film and look at it. We looked at it, couldn't see anything on his normal chest. She'd come over from North Carolina to visit her sister. They told her she had cancer. She quit her job. She was with her sister doing things she liked to do and wanted to do. And now she may have changed her lifestyle and her diet, I don't know. But there was nothing on her plain film to show any evidence of cancer, and she had obvious tumor on there, because he got the reports from our previous hospital records, and I didn't get much follow-up on it, but that was one case that I remember. There's some other things that I need to tell you about vitamin C. I'm going to get in just a second. No, don't get.
You want to do that?
Wait. Let me show you this.
Because you only have a few minutes left.
Yeah, I'm going to be through in just a second. Whoa. I don't want to get. Oh yeah, I just wanted to tell you that at the time that I was in medical school, you know, the OBGYN department, now this was at the University of Arkansas, and they said that the trophoblastic theory of cancer was the only one that had any scientific weight behind it. Well, I agree with them now, and that's encompasses everything that you've heard today from all these other speakers. They just hadn't told you that the cancer cell, what the cancer cell is, but it is the most primitive cell in the life cycle if you subscribe to the trophoblast theory. And that would make sense that the most primitive cell in our life cycle would be the one that does that. Okay, what would be the most advanced cell? Probably a cortical neuron, I suppose, is the most differentiated cell. Maybe it's something else, but that would be the striking difference between what can a stem cell produce. It can produce this devilish thing called a trophoblast, and it can also produce a cortical neuron. So there's a wide range of what it can do, and you have to think, well, what does the trophoblast cell do? Well, you know, I may be getting a little bit out of order here, so let me get to that in later. Anyway, after I got back from Bright Spot, I started using the IVC myself to see what it would do, and now I'm going to tell you about that, and we got 30 minutes. Okay, so first thing I noticed when I got home was that I had this little, I didn't get a picture of it, but it was like a wart or something in the sideburn, and I couldn't see it, so I had to get my glasses like this and look in the mirror. You know, I could see it looked like a little basal cell, so I thought about it. All of a sudden it came to me, hell, put vitamin C on it. So, you know, knowing that 400 milligrams per deciliter will kill cancer in the blood, hell, I can make a solution that's many, many times stronger than that just by dumping it in water. You know, vitamin C, you can put about 500 milligrams in a cc of water. Now, 100, that would be 100 times 500, that'd be 50,000 versus 400, right? Anyway, it's so much more concentrated than 400 milligrams per deciliter. It's unbelievable. But you have to keep it wet. And this is important because and one thing that's not written down in the books is everything in our body, all the chemical reactions, everything is carried out in a water medium. Everything. Dried, it's not going to do anything. And it'll dry up on your skin and form crystals and stuff like that, you know, and that's kind of irritating. But this was a picture of, can you see that? Yeah, I guess you can. That was me and Dr. Riordan and Ron down at the end there, and the other two docs are around here somewhere. Not here, but they're in town. You know, I discovered Linus Pauling been right, and then let me tell you about the guinea pigs. Guinea pigs are, it's interesting because why did they end up as laboratory animals? You know, just pick them out of the wild, because they get all our diseases. Why do they get all our diseases? You know, you can't study human disease in an animal that won't catch our disease. So they're using guinea pigs. Why? Because guinea pigs don't make vitamin C, but they didn't know that. Nobody knew that. Rats and some of the monkeys and stuff, you know, you can stick them with all of these human diseases and they just go on about their business. But guinea pigs get all of our diseases, so guinea pig proves to be a good model to test vitamin C in. So what happens? Anyway, that's a picture of me taking some vitamin C, and I'll get back to the guinea pigs here in a minute. But I want to show you some of the things here. That was the lesion I discovered. I don't have a picture of it. I do have others. That's kind of sort of like one. It's not completely gone in that last picture there, but you know, I couldn't find it anymore on the skin. It looked like, you know, everything else. It was hard to discover where this lesion was anymore. And so I was wanting some other kind of skin cancer, and lo and behold, this guy saw a picture I had in a health food store, and he came by with this ugly looking squamous cell carcinoma and a biopsy. He had a biopsy on it. It showed it was a well-differentiated, this is it right here. He claimed that when he was cleaning up after Katrina, the mud off the tractors, you know, that sling up dirt and everything, if you ever work out in your yard or get somebody out of a mud hole, you know, and you're pushing them out and all the dirt comes up on you. And all of the toxic chemicals in there, it made a lesion on his face that wouldn't heal up. Now, Katrina came by in 2005, I think, wasn't it? Something like that. And so this thing had been developing on him for a year or so. It'd been about a year, and that's pretty bad looking. And he came by my house. Now, he had been to Mexico in his 20s and been cured of colon cancer with vitamin C. And so he was well aware of it and had a lot of diet information with him, and it was on some website. And so he started putting the vitamin C on this lesion, and I just told him to keep it wet with something, spray it on with a sprayer or something, do anything you can to keep it wet. And after about a week, it was looking pretty dirty and nasty looking. And so I said, clean it off with some peroxide. And so he come back in about 4 or 5 days. He said, man, Doc, I think that peroxide had more effect than the vitamin C. And so I argued with him a little bit, but then I was thinking about it. I said, you know, it does produce peroxide at the tumor site. And so next time I talked to him, I said, well, you know, you may be right, because the peroxide, according to the literature, you put it in cell culture with cancer cells and normal cells at the same concentration that's created by the vitamin C, you get the same effect. Now, so I think that's his biopsy there. It says the tumor is transect, and he says it's the surface of infiltrating, well-differentiated squamous cell carcinoma, and that's a dermatopathologist. Anyway, so here was this lead. Now, that was on 11/19/09, and that was January 13th of 2010. That's about 2 months later, and it's gone. I mean, this is 2 years later, and there's nothing there. It's just like it was before. Now, some people use ascorbic acid. This got onto killing cancers with vitamin C got onto the internet, and so people with vitamin C use ascorbic acid, and have lots of pain when they put that on their skin, because all these skin cancers have some areas with nerves hanging out and stuff like that. And sodium ascorbate is neutral. When you put it in water that's measuring a pH of, say, 6, comes out to like, well, I can just tell you the pH paper is not a real good, accurate thing, but it does give you an idea, and it comes out to 7 every time. It doesn't matter whether it's, you know, just a few. So it acts as a buffer. Sodium ascorbate's actually acting as a buffer. And when Clinner, or if I got the name right, when he made vitamin C early on years, they all used sodium ascorbate and made it up in their office. And it came out to a neutral solution. And I think that injecting something with a neutral pH is much better than something that's acid. And most of your IV fluids, if you look on the bottle, the pH is adjusted with sodium hydroxide to 5.5 to 7, I think they say, or 6. Anyway, in addition to, we use the vitamin C from Merit, but we put a little bit of, about 5 cc's of bicarbonate solution in there anyway, just because it's cheap, and I think bicarbonate's a good thing, because alkalinity is good for us. Everybody here that's talked so far today has raved about alkalinity. Acid environments inviting bad things live in acid environments. And we best keep our bodies alkaline. And you'll see more about that and hear more about that as time goes on. That's a photograph from January that was an update in August. The second picture on the right there, August of that year, and this was just 3 weeks. That's a better one. That white stuff on there's nothing. That's been there all forever. That's just part of him. But you know, this thing came off with no scarring. If he'd had surgery to take that off, they'd have whacked out a huge piece of tissue and had to do skin grafts. It'd have cost him a fortune. He got the stuff to cure this at the dollar store. You know, that's bad for business, but look, it's good for humanity, you know, it really is. This thing about the guinea pigs, let me talk about that, this atherosclerosis. Linus Pauling and Matthias Rath, who's a German cardiologist, took guinea pigs, and it's already been done by this guy Willis up in Canada, like back in the 50s, I think. And that would have been long enough to go to where my dad could have gotten hold of it. He'd still be alive today, or he'd be, you know, maybe on his way out, but not, you know. He wouldn't have died at 60. See, I'm 64, so I'm on borrowed years now, borrowed time. But these guinea pigs, they raised them on diets that were equivalent, except for the fact that one group of guinea pigs got the animal RDA for vitamin C, 50 to 2, I don't know what they use, 50 or more milligrams per kilogram. The other group got the human RDA, 1 milligram per kilogram. And then when they slaughtered the animals, after a period of time, because guinea pigs don't live forever, I think 5-7 years or something. And so you can get an idea of what's going to happen. They develop atherosclerosis all over, where in the group that had the 1 milligram, the group that had the 50, no atherosclerosis in their arteries, clean vessels. These were on guinea pigs on the same diet. Now, it had already been suspected that vitamin C or nutrition had something to do with atherosclerosis, because in the Korean War, we had these young guys coming home, and on autopsy, if they died there or died here, I don't know, they had atherosclerosis, and I think some of them probably had it when they went over there, because, you know, fast food came in somewhere in the 50s. Our diet, since 1850, when industrialization happened, our diet has progressively gotten worse and worse. Another incident from medical school, when we were in pathology, one of the pathologists told us that when he was in school, and I suppose when he was in school it was probably in the 30s, he said his professors told him to come see, we got a case of lung cancer. You'll never see a case, this is a rare disease. Lung cancer, rare disease. And you know, of course now it's real common, but people blame it all on smoking. And even at the time I was thinking, well, how could that be? Because people smoking like chimneys before 1800. I mean, they were smoking stuff, you know, building fires and fireplace, smoke filling the house up and everything. Of course, it's just cigarette smoke. It's not smoke from, not the diesel fumes from ambulances and all that to just blow this stuff all out in the ER lot. And they just allow that, but then somebody come out there and light up a cigarette. Oh, get out of here, you're gonna kill everybody. You know, it's insane. The cigarette is nothing more than air pollution, concentrated air pollution, and it's probably made much worse by the companies that pollute the tobacco with 500 or 600 chemicals to make it freebase of nicotine and make it much more addictive. You know, left alone by itself, it's probably a helpful product, because people that do take in small amounts of tobacco, is it Parkinson's disease? One of those diseases they have a pretty much resistance to. They don't get one of those neurodegenerative diseases. I believe it's Parkinson's. I think so. Tobacco. Now, think about it. Tobacco is a leaf. You know, it's something from nature, and nature doesn't make a whole lot of horrible things, but we can, you know, not saying we should smoke, but I think it's been demonized. But the fact is that now today, lung cancer rates have gone up, and cigarette smoking is down at the lowest level it ever was. And all these people that now, so they now blame it on secondhand smoke. But what they want, they're trying to find, you know, a scapegoat other than, you know, it's our environment or it's our food source. It's because you're smoking, quit smoking, and all of our terrible ills would go away. Well, you know, I knew that was wrong, and that's kind of gonna, you know, fall into the dirt like a lot of other things. Anyway, one interesting thing is Pauling took all this, was excited, took all this information to a drug company, and they just not interested because good research, but we can't patent vitamin C. You know, there's no business usefulness to it as far as the drug company was concerned. That conference that he went to, there was one cardiologist that pursued vitamin C after that conference, and he said at the noon lunch break, there was total silence. There's nobody talking. Because these people see the end of their career. You know, they're gonna have to do something else now. This guy's put all the scientific evidence up here. I mean, he's proved it. And the only one that went and pursued this vitamin C heart disease connection was the head of cardiology at Harvard. And he was dismissed of his duties about 2 months later. Now, there was one cardiologist, though, that found out about this that did pursue it. He might be sitting in this room. Is Tom Levy here? Yeah, Tom, believe it or not, was in New Iberia when I was there. He was the first cardiologist we had. And he left in the early 90s, went out to Colorado, pursuing cardiology, I suppose. And I was reading a book by him one day. I didn't know it was by him. I'd ordered a book, Vitamin C, Infectious Diseases and Toxins and all this stuff. And I was looking on and said, Tom Levy. I said, that's not that guy that I worked with, is it? And I look over on the back page, and yeah, it's his picture right there. It looked like him. And so, you know, Tom had gone out to Colorado, and he saw what IVC did to a lady that had multiple sclerosis, sitting in a wheelchair, and had all these teeth, had all these things removed from her mouth. He figured she'd need hospitalization. She wanted to get up and go dancing after this procedure. He couldn't believe it. And the dentist pointed to the IV bag and said vitamin C. And that's the first time he got exposed to it. Well, here was this, he didn't understand it. but it had a miraculous effect. And that's the same effect that I saw in myself and other people when we gave it to them. You take somebody that's got the flu or symptoms like that, and it just goes away. I mean, while they're sitting there a lot of times, I experienced myself, and it's a miraculous substance, it really is. And you won't believe it unless you see it. And so I understand why he did what he did, because it made me do the same thing. Because if you're looking for truth in something, this is where the truth is. This is the truth. Anyway, we had another fellow with a squamous cell carcinoma in the lymph node by biopsy, and he was a rice farmer. He followed the Riordan protocol to a T. He came in with a notebook full of papers and all these health ideas and things. I learned a lot from him. And his node never got any bigger, got a little smaller. He went for 2 years, 6 months, twice a week. He was a small guy, so we just gave him 50 grams, and then he tapered off. He's been out 2 years now with no growth, but you know, when people go out and get away from you and get away from other people, they start going back into their old ways. So he's eating a lot of his candy and stuff now, and ice cream and all that good stuff. I talked to him the other day, and I told him he's going to have to get back on his stuff. He is taking 2 liposomal vitamin C's a day, but he's gone back to his old ways. He had been getting 50 grams once a month. You can tell he's gone back to his old ways because he gained back 20 pounds. And he said his node's enlarged a little bit, but he says it's stable. So, you know, this is the way it goes. You know, it's all about the environment on the inside of your body. The environment that's around us here in this room is also inside of us. You know, when we pollute the environment here, we pollute it for ourselves and everybody else. You can't throw something in the river and let it be the neighbor's problem. It's going to come back and be your problem. And when we finally learn that and start acting like these animals and learn how to live in harmony with nature and not in disharmony, then we'll have a good society. But, you know, something I have to change about the human spirit to do that, I think. There's another fellow. This is esophageal carcinoma, but it demonstrates one of the things about vitamin C. When you read in the literature, you'll see that it makes peroxide as a cancer site. Well, this guy came in with esophageal carcinoma, and we gave him so much vitamin C, you know, it could have killed him. You'd have thought. Anyway, after he was averaging 287 grams a week from October to December, he had a 75 gram, it says 100 in my files, but it said 75 grams on the thing up here, so it was 75 or 100. We took his vitamin C level, it was 243. Now, I just looked at that slide that the fellow put up here before about that showed the decreasing levels of vitamin C with disease, like a normal person, so many 15 grams would go up this high, with a person with cancer go that high. So I figured the ratio and multiplied it. This man should have had a vitamin C level of around 400 to 500, you know, based on that ratio there that you showed somebody. So he was eating up vitamin C like gangbusters, but the thing that was really amazing about it is I thought he was chewing tobacco, because he always needed this little this cup with a paper towel to spit in while he was there. And I found out this was foam he was spitting out of his mouth. It was just white foam coming out of there. And he had esophageal carcinoma. Well, you know, if you're forming peroxides at that site in your esophagus, it's going to go somewhere. And the foam was coming out. And he was filling up this. Yeah, so believe me, they're not lying there when they say that peroxides are forming at the cancer site, because they are. And that's proof of it. This is just what I was telling you. Oh, yes, and he got so bad, I wanted to do something for him. I called Oasis of Hope, and they picked him up in San Diego and took him down there. And his wife said when they walked into the place, he said that he felt like he was in the place he needed to be. He was totally comfortable with it. He said the staff was good to him. She said they could see the ocean from where they were. She walked out to the beach. This was in Juarez. She was never shot at, mugged, raped, or anything. And, you know, she said they were very respectful of the hospital staff. I was just saying that they had a good experience down there. I don't know what it cost them, but their experience was very well. And he said he was an industrial chemist too, and he had done studying about stuff like this, and he had no regrets about what he pursued. He knew he was going in the right direction, and that not everything's guaranteed, but he was convinced of it. This is a picture of a wart that I infiltrated with vitamin C. It's hard to see on the right hand. In fact, this first picture was taken a couple of weeks after he was injected. See, I didn't get an initial picture. It looked worse than that, but they actually went away. These are big verrucous things there. And
Just one time?
no, yeah, just one time. And what I did is I mixed the vitamin C from Merit Pharmaceutical with xylocaine 2%, 50-50. And I infiltrated with a 27 gauge tuberculin syringe at 9, 12, and 3 o'clock. And it filled it up and wheeled a flare around it. And I injected a few other warts, some plantar warts. And the reason I did him is because I had one here, right here, that was a bad one. And I was trying to get rid of it with vitamin C. It wouldn't go away. So I got mad and I stuck it with the needle. I'll get you. And it did. It went away. That sucker just died off. I mean, if you give a personality these things and start, I think they accept that they're evil and die. You know, it's a lot of it's based on attitude. You know, I tell these patients, you got an unwanted guest in your house, and this guest does what? Guess what? We know what it likes. It likes to eat sugar. It loves sugar. You know, and it's just like, so if the person has any sense, they'll think, well, I'll starve that son of a bitch. Yeah, you know, the doctors don't tell them that cancers live on sugar, and they love acid. So what do they like? They like Coca-Cola, don't they? Yeah. So, you know, Coca-Cola doesn't grow in nature, neither does candy bars, and we all eat those kind of things, but you have to know that you're feeding these little evil things in your body when you do that. And so, you know, just be cognizant of that. And someday, you know, you can always quit it. And another thing is, I don't tell people to give this up and give that up and everything. I say, you know, it's bad for you. Just try to cut back on it. Like in food and stuff, go on a vegetarian diet. But, you know, you can eat something on Saturday or Sunday if you want, you know. But I said, if you eat something good right now, like an orange or an apple or something, that means that you'll probably eat less of the bad stuff later on. You see, don't tell yourself you're not going to eat the bad stuff. Just eat a bunch of good stuff right now, and you won't even be hungry later on, and you'll forget about it. And people go 2 or 3 days and get on this diet, start feeling better, and so it's like a snowball effect, and they like that. Now, fever blisters was just another thing. I never had another fever blister after I started taking high-dose vitamin C. We had an RSV, respiratory syncytial virus, and a 1-year-old was supposed to be sick for a couple of months. We gave him IM vitamin C in the buttock, 1 cc of the Merit mixed with, I think it was 2 cc's, or 1, I can't remember exactly. And he had that on 2 consecutive days, and he never had any, he got well, and that was the last we ever heard of that. He was taking these, the 500 milligram wafers that you suck. A lot of kids will eat that candy vitamin C, but get the kind without aspartame in it. It's got a little, maybe a gram of sugar in there, but so what? That's not much. He had a brother that was 3 years old that had told by the doctor he had German measles. He'd been sick for a week, and his daddy happened to be my son. And I wanted to tell him, you know, he was up in Ruston, Louisiana, and he suggested giving him a shot IM. And I'd never give anybody a shot of vitamin C IM, and he had some up there. So I said, if you can inject him, do that. I said, draw up a cc or 2 of that and give it to him in the butt. He said 30 minutes later he recovered from, it took him 30 minutes to recover from the shot. He said after that his fever was down from 100, it went from 104 to 98 in 30 minutes. And he was playing like, you know, he had never been sick. And I told him, I said, you may have to give him another one the next day because that's usually not enough. You know, the docs say you have to keep the fever away for 72 hours. And I think they ended up having to give him a little more vitamin C later, but it just basically stopped with that one shot. I mean, he had a little fever the next day, and he started eating oral stuff. But see, when he had fever and stuff, he wouldn't eat anything. He couldn't get any oral vitamin C down. The kid get dehydrated and all that stuff. It snowballs. My mother had a little sister that died from dehydration when she was born in the 20s. You know, people died from dehydration back then. The kid get diarrhea and dies. I mean, that's because they couldn't take fluids. Seasonal flu is something that just goes away while you're injecting the people, the aches and pains and all that stuff. If that's what they have, if it's viral, it's not going to like that vitamin C. A hangover. This might be interesting because this fella came in with his dad or uncle or something that had cancer, and he was suffering a bad hangover. So we gave him. I said, I want to see if it has any effect on you. I'll give you 25 grams for free, and see if it cures your hangover. It dripped in. He left. He said he felt good when he left, and when the patient came back the next week, he said the guy raved about it all the way home. They couldn't believe that just like that, it's gone. Don't have too much time, but cancer is a proliferation of cells outside the normal somatic controls of the body. And the most malignant form of cancer, depending on who you look at, would be something like choriocarcinoma. Well, you know what choriocarcinoma is? All it is metastatic trophoblast from the placenta. Now, I don't remember what they told us in medical school. I think they said they get out of there and they turn into cancer cells. Well, listen, they're already cancer cells, because if you look at how cancer develops, you know, from this anaerobic environment, you subject these pockets of anaerobic areas in your body. What if there's a stem cell in there? What is it thinking? Well, it might be thinking the same thing that a newly fertilized ovum is thinking when it's in the fallopian tube. Now, what is it? It's called the zygote, but what is it? It's an embryonic stem cell. Where is it? It's in an anaerobic environment. What does it do? Well, it forms a morula, and then it differentiates and forms trophoblasts from gametogenesis cells, and trophoblasts only have 23 chromosomes because they're haploid. And guess what? In the placenta, the trophoblasts form in the syncytiotrophoblasts layer and migrate up into the cytotrophoblasts, and syncytiotrophoblasts. And then what do? They form multinucleated giant cells. Have you ever heard that term before, multinucleated giant cells? I heard that all through wherever. I think they're kind of a common thing that they see in tumors. And also because these are formed from meiosis, MEI, meiosis, a reductive division, and that meiotic divisions have been reported in cancer since 1870 or whenever they got a microscope. So, and another thing too is that trophoblasts make the hormone human chorionic gonadotropin, and this protects the fetus is nothing more but surrounded by a chorion produced by the trophoblasts, which come from the stem cell, and their job is to protect that fetus from the mother's immune system for 9 months, and also provide a blood supply, create the placenta. If it's successful, you have a baby. If not, you don't. A lot of the fetal growth retardation things are due to immune attack from the mother onto the placenta. Now, Linus Pauling said that the cancer proteins that make up the capsule surrounding most cancers are right-handed amino acids, which would be subjected to digestion by our pancreatic enzymes. John Beard, a Swedish embryologist, had noticed 100 years ago that when the pancreatic enzymes start being secreted by the fetal pancreas, the zymogen crystals, that the trophoblasts start dying off. And you can read in the embryology books that as pregnancy progresses, trophoblasts die off. If they don't die off, the HCG levels continue to be elevated. And that's how you diagnose choriocarcinoma or invasive carcinoma down there in the pelvis. The local invasion would be from persistently elevated HCG levels, can get up to 1 million units. These trophoblasts produce that HCG, and it's been found in almost all expressions of cancer. There's tests that measure it down to as low as 1 unit, I think, now. But most of your over-the-counter pregnancy tests go 50 units, I think. And we had a fellow with cancer that had one of those tests run. His level was like 52 or 3 or something like that. There are some labs that check those. That might be better than CEA. as a marker. Might be something worth looking into. But it is made by the trophoblast, and the trophoblast looks like a cancer cell, acts like a cancer cell, has all the features of a cancer cell. It divides, it forms an outer layer around the blastocyst in the uterine cavity, and then invades the uterus like no cancer could ever do. I mean, it does a good job. It invades so fast and tears everything up, forms a placenta, and if you read about what it does, it's horrifying. You know, but the body uses this cell to control stuff. Now, is cancer a healing process? Well, this is another story. When I was working in an ER as a resident, I wasn't a radiologist yet, one of the pathologists came by and looked at a bone tumor. It was a fracture of a femur. He wanted to see it. And I asked him why. He looked at it. That looks like a healing fracture, doesn't it? He said, yeah, it does. And you know, you can tell a healing fracture from a pathologic fracture in a bone. The X-ray evidence is pretty strikingly different. It's pretty obvious. So you can tell on X-ray a healing fracture from an osteogenic sarcoma. Well, he said, you know, under the microscope, he said, you can't tell the difference between an osteogenic sarcoma and a healing bone fracture. Now, he told me that back in 1980, maybe before that, 78. So if you think about, if you look at a stem cell in the tissue and you deprive it of oxygen, you put it in the same environment that the initial stem cell was that formed a fetus. And what is a tumor? It's an encapsulation of stuff. And inside of that capsule is what we call tumor tissue. But that tumor tissue in there is not really malignant. It's unusual, but think about this, if it's in the liver, it always looks pretty much the same. Liver hepatomas or carcinomas look the same. Well, the stem cell in the liver generally makes liver cells, right? So if it gets malignant, it's going to make a fetus. Not going to be a fetus, it's going to be liver cells in there. If it's in other organs, it'll be something else. So, and it's surrounded by a proteinaceous shield. I've also read that the protein coat around cancer cells is negatively charged. And natural killer cells have a negative charge on their outer coat. Cancer and tumor also put out antitryptic factors in the blood. This ties up your peptic enzymes with dummy things in the blood so that it can't. Same thing as putting proline in with your vitamin C the proline and lysine have an effect. Livia will tell you about that. They help to remove the plaque from the arteries because the lysine and proline is exposed with the lesion where atherosclerosis starts in the artery. These molecules stick to it. It's the lipoprotein A, I think, that sticks to it. Anyway, that's what the reason we get atherosclerosis is because we don't have enough vitamin C to heal the damn thing right, and we didn't have enough there to make this tissue strong in the first place. So it's not strong, and where does it bust down? It busts down where arteries bifurcate. You see? Otherwise, you'd have atherosclerosis everywhere. You'd have it in your veins too, but it's due to the weakness of the collagen tissue in there, and fellow proved back in 1950, the same guy did the guinea pig experiments, that these areas of the artery were totally devoid of vitamin C. He did samples of them. Now, I think we've kind of gotten to the end of things. These are some funny pictures I drew, but it just shows you how anaerobic environment.
He didn't know how to use PowerPoint, so he drew it on a whiteboard and took photos of it. So you guys have it.
You know, I was trying to think, well, if I'm a stem cell, you know, I'm in an anaerobic environment. Well, I'm kind of going to do what my brothers did up there, huh? Probably. I'm going to do the same thing. You know, you can't produce life in this environment. Life needs oxygen. And this stem cell is going to make a differentiated ductal epithelial cell or something. Well, it's been doing this, but they're all dying. They don't have any respiratory enzymes, you know, for many, many different reasons that we've listed. And so they may be stimulated to do what the embryonic cell does, form trophoblast and create new life inside of this called, you know, inside the tumor. It's something to think about.
We got to close it up now.
Yeah. These are just some, this is a picture of a uterus. They're pretty good. But it's been 6 days, this cell's been 6 days outside, 6 days after fertilization, it's ready to implant. In those 6 days, it does what a tumor in the tissue can do maybe in 6 years. Because tumor in the tissue has to be relatively hidden from the immune system, and it can't just rapidly produce. When it's outside the body, it can do anything it wants. And when it's ready, it goes into that endometrium with the vigor of a highly invasive tumor. So that's, I pretty well covered it.
Well, thank you.
There's how Dr. Riordan treated patients. Oh, there's something else on it.
Show that last slide.
Yeah, this is just an example of like liver in a stem cell, chronic anoxia, produces an encapsulated tumor. I said some of these things. Is that other one the picture?
You're the one you drew, or the typed up thing?
Yeah, I want to show y'all what you're members of here. If you take a lot of vitamin C.
Oh, right there.
There you go. Homo sapien ascorbitus. You can overcome your L-gulonolactone oxidase deficiency, become a creature of a new and more robust, longer-living human subspecies, Homo sapien ascorbitus. And it's the only species that's going to survive the bug attacks and